Cranberry concentrate capsules are commonly used to reduce the risk of bladder infections, also known as urinary tract infections. Some people also use it to decrease the smell of urine in cases of incontinence. However, it's important to note that this product should not be used alone to treat bladder infections, as it may not be effective and could allow the infection to worsen. It's always best to consult with a doctor or pharmacist for more information about the specific brand you're using. It's also important to mention that the FDA has not reviewed this product for safety or effectiveness. As for the daily dosage and optimal timing, it's best to follow the instructions provided on the product label or as directed by your healthcare provider. When taking the cranberry concentrate capsule, make sure to follow the directions on the product package. If you are taking the chewable form, chew it thoroughly before swallowing. If you experience symptoms of a urinary tract or bladder infection, such as fever or painful urination, it's important to consult with your doctor. If you suspect a serious medical issue, seek medical help immediately. When taking cranberry concentrate capsules, be aware that stomach upset or diarrhea may occur with very large doses. If you experience these effects and they persist or worsen, it's important to consult your doctor or pharmacist. Additionally, if you experience severe stomach or abdominal pain, it's crucial to seek medical attention right away. While serious allergic reactions to this product are rare, if you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing, it's important to seek immediate medical help. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Always consult with your healthcare provider before taking any new medication or supplement. As for the daily dosage and optimal timing for taking cranberry concentrate capsules, follow the instructions provided on the product packaging or consult with your healthcare provider for personalized guidance. Before starting a cranberry concentrate capsule, it's important to talk to your doctor or pharmacist if you have any allergies. This product may contain ingredients that can cause allergic reactions. If you have a history of kidney stones, it's essential to consult your doctor or pharmacist before using this product. Some forms of this product may contain sugar or alcohol, so if you have diabetes, liver disease, or any other condition that requires you to limit or avoid these substances, make sure to ask your doctor or pharmacist about using this product safely. If you're planning to have surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you're pregnant, this product should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. If you're breastfeeding, it's best to consult your doctor before using this product to find out if it passes into breast milk. When taking cranberry concentrate capsules, it's important to be aware of potential drug interactions that could affect how your medications work. It's always a good idea to keep a list of all the products you use, including prescription and non-prescription drugs, and share it with your doctor and pharmacist. This will help them to determine if there are any potential interactions with the cranberry concentrate capsules. Remember to never start, stop, or change the dosage of any medicines without your doctor's approval. It's important to work closely with your healthcare provider to ensure the safe and effective use of cranberry concentrate capsules. In terms of daily dosage, it's typically recommended to take 1 to 2 capsules per day with a full glass of water. The optimal timing for taking cranberry concentrate capsules is usually with a meal to help with absorption. Always follow the instructions on the product label and consult with your healthcare provider for personalized recommendations. If someone has taken too much of this cranberry concentrate capsule and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Make sure to keep up with all your medical appointments and any lab tests that your healthcare provider recommends. It's important to stay on top of your health and follow through with any necessary checkups. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed one and take the next dose at the regular time. Do not take a double dose to make up for the missed one. When it comes to storing cranberry concentrate capsules, make sure to check the storage information on the package. If you're unsure about where to store them, it's best to ask your pharmacist. Keep all medications and herbal products out of reach of children and pets. It's important not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. For guidance on how to do this, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.